Hi everybody, my name is Jonathan Wright. I'm Head of Patient Access at University Hospitals Dorset, and I'm here representing all of the staff involved and the patients and volunteers from the Dorset system. Anyone who doesn't know where Dorset is, it's down on the south coast, and as I found out today, it's actually quicker to get to France than it is to Birmingham. So everybody had a massive challenge before the pandemic, but the pandemic made it even harder for us around our elective care and waiting list size. As we've all lived through or seen on the TV, lots of elective procedures, operations, outpatient appointments, they were all cancelled. Our waiting lists increased in size to the point where we had 112,000 patients just in Dorset overdue and waiting for an appointment or a breast screening appointment. So we knew we had to do something, and we challenged ourselves to think differently and to think big. So our ambition was to deliver a high-flow clinical assessment facility in a safe clinical operating environment in order for us to work through our waiting list, triage and risk stratify our waiting list and the patients on it in Dorset, and help those patients that were waiting to wait well while we recovered our waiting list. At the beginning, we had ambitions for staff as well as patients, but here are our patient ambitions. Excuse me. So we wanted to make sure that whatever we did, the information was really clear for our patients to navigate to this facility, that there was dedicated disabled parking and easily accessible by train, by bus, by car, by foot, by bicycle. Digital check-in to be simple and stress-free. We didn't want to compromise privacy or dignity. We wanted to make sure that appointments ran on time. Traditionally, outpatient departments have got waiting areas full of patients waiting, and you judge it by being busy there. We didn't want that. We've got it wrong if we had a waiting area, so we wanted to not have any queues. We wanted to really get an awful lot of feedback from patients, and our volunteers have helped do that. We wanted the space, although not a hospital, to feel clean and safe and have the social distancing guidance. We wanted to make sure that it's clear what's going to happen next for our patients after their appointment, and we didn't want to make their appointments feel rushed. We wanted them to feel valued. So we made sure that whatever we came up with, we had to basically maximise the time that we had of the patient in front of us, and also maximise the staff resource that we had. So a really busy slide, but it shows our roadmap of us having the idea back in March of 2021 to create a new facility all the way through to December 21, so 10 months later, opening our doors to our first patients. On the right-hand side of the screen is some of the patient feedback that we've received. But what did we actually do? Well, we opened an outpatient assessment clinic on the second floor of a department store in a shopping centre in Poole. We looked at lots of different options for where it could be. We looked at trading estates with empty shops. We looked on the high street for empty shops. The one we went with was the best that was available at the time that suited our need. It's about half the size of a football pitch. We had to run lots of processes in parallel, so there was CQC registration, there was signing contracts, there was the procurement, and the big partnership side of this was we managed to access the contractors and the architects and some of the materials that were used in the Nightingales, so we were able to repurpose those and fashion them in. I talked about involvement to make things real, and it was in the middle of the pandemic, but we took over a conference centre in Bournemouth, and we put on the floor, literally mapped out what the facility would look like with the flow to keep, from a social distancing point of view and keeping the correct access for staff and patients, and Bournemouth University students helped us do that. And we had some anchor specialties right at the beginning: ophthalmology, breast screening, orthopaedics and dermatology, and some other followers that came on a little bit later. I think it's now 9 specialties we have running. Spent a lot of time with those specialties saying, this is not just about picking your clinics up and doing them somewhere else, it's about working differently, testing out new ways of working, thinking about things very, very differently. And that's exactly what they did. I won't read this out, but we had a patient governor on the project group, on the program group, and this is what she said, but it was a real theme that came through, that there was no hierarchy. It was all about us getting on. We all had day jobs, but on top of that, coming up with this facility and making it happen as quickly as we could. So some of the themes, some of the look-backs that we've got from doing it, and we've held an event afterwards, was the culture and drive and enthusiasm to get things going on time and on budget, which we did achieve. Rapid decision-making, we had meetings every day, and people had an action to do by tomorrow, or for, if it was a slightly bigger one, for the next program group, which was twice a week. So we just kept that going, and if somebody couldn't do it, it was, let's help them. The legacy around involvement in design and how we attempted to deliver the project we've rolled out into other projects since. We've always thought about, this is a minimum viable product, so what's the basic needs, basic things that we need to make this work, and that's exactly what we did. Consistent story about how do we help our patients wait well, how do we get through the waiting lists in a safe way, valuing patient and staff's time. As I mentioned, space for creativity, so looking for solutions, not just talking about the problems. I mentioned about us doing it on top of our day jobs, and a few other bits and pieces there that we've learned. So what have we done so far? So we've seen just under 8,500 patients across 9 specialties, and with about half a day's notice, we managed to open up and do 2,400 vaccinations just before Christmas. And again, it didn't impact on the rest of the organisation, so the acute sites could carry on with what they were doing. We didn't have to stand anything down. And just an example of the different ways of working. So dermatology have nearly tripled their pre-pandemic capacity, so they now see 96 patients in a session. We also had another pop-up facility in Dorchester, and they focused on orthopaedics, and they saw a 52% reduction in their waiting list, a 92% decrease in those waiting over 78 to 104 weeks, which was phenomenal. What have our patients said? Well, they've said, here's just 3 things that kind of just show how positive patients' feedback has been, that they feel that the facility is more convenient than a hospital or mobile unit for breast screening. Access was easy, and also that the overall visit was a good experience, which again speaks volumes. Was some feedback about what else we could do differently. So again, you can read these, but it was a lot about communication and about signposting. So we've done a lot on wayfinding, but needed to do a bit more, say from the taxi rank to the facility, but also patients said, well, I can get a discounted taxi to the hospital, and we managed to sort that out to the facility as well. And the same with the parking on level 1 when the car park actually had letters instead. I was going to finish on this poem that one of the patients wrote, so again, I'll let you read it, but thank you very much.